My name is Dr. Zachery Smith, and your pet's been diagnosed with patella luxations. Now, most commonly, these are medial patella luxations, meaning that the kneecap, which is the patella, is moving towards the inside of the body or the inside of the knee. But they can also be lateral patella luxations, and both of them are a manifestation of the same condition. The reason that you get kneecap or patella luxations or displacements is because dogs have a malalignment, or some dogs have a malalignment of their quadriceps mechanism. What does that mean? The quadriceps mechanism are the muscles that go down the front of the leg. So they originate up at the hip, they go down the front of the leg, and they insert onto the kneecap or the patella. From there, it becomes a patellar tendon or a patellar ligament that then inserts down onto the front of the shin bone. That complex has to create a straight line through the end of the thigh bone, or else the kneecap has the propensity to move out of the groove that's at the end of the thigh bone that should prevent that patella from ever moving. So just like you and I, if you were to take your kneecap and try to move it out of the end of your thigh bone, you can't do it. It may be able to move a little bit, but you can't displace it unless you have a problem. The same thing is true for a dog. It should never be able to move out of the end of the thigh bone. A cat as well. Now, this condition is most commonly seen in small breed dogs, cats, and sometimes seen in medium to large breed dogs as well. When we think about that muscular complex, what it essentially is like, it's like taking a string. And when you straighten or tighten that muscular complex, you take that string and you tension it, it makes a straight line. When that muscle becomes taut, if that straight line is out of alignment with the end of the thigh bone, or that groove at the end of the thigh bone called the trochlear notch, then that kneecap has to stay within that straight line. So it's going to displace out of that trochlear notch. So how do we address this? How do we fix this surgically? The way that we then fix this is to realign that line or that mechanism through that trochlear groove so that that kneecap will no longer move out of the end of the thigh bone. Some dogs with medial patella luxation require surgery, others don't. There are a subset of the population of dogs that will go on to live their normal life without any limping or lameness or any issues associated with their patella luxating. These tend to be the smaller breed dogs, and what we'll see is that they won't have any issues, but when you come in for your exam, us as doctors, we may be able to move it out, the patella out of the groove. These are generally low-grade patella luxations, and we may or may not recommend surgery for these based on the clinical signs seen at home. For the higher grade luxation, these are the dogs that are clinically affected. So, on a regular basis, they will be running and they'll skip and they'll get their knee kind of locked and they'll be kicking it, picking it up, and then they'll intermittently put it down, or they'll persistently have a lameness. In those patients, surgery is strongly indicated. The most common way that we'll actually fix a medial patella luxation is by moving the insertion down at the shin bone out laterally. So we'll take where that tendon goes and inserts on the shin bone, and we'll actually move it in alignment with that patellar complex, with that trochlear groove, and then we'll put it back in position there and pin it in place. The other things that we'll do is we'll actually assess that trochlear groove. Since the trochlear groove requires the kneecap to be in place as it's developing to be able to develop the depth of it, a lot of these dogs will have this really shallow groove. Because this problem is a developmental problem. They've had that malalignment since they were a puppy, and as that groove was developing, that kneecap wasn't always in place to wear that groove, so they'll get even sometimes a convex groove where there isn't even a groove present. So if that is the case, if it's either shallow or the ridges have worn down, what we'll do is we'll actually go in and we'll deepen that groove. To do that, we'll actually cut the cartilage out, pull it out so that we can save that, and then we'll make a cut underneath to take out bone underneath that wedge of cartilage, and then replace that cartilage back in the groove so that that cartilage is there for that patellar to run on, but it's seated much deeper into that groove to deepen it. This provides a bigger barrier for the patella to have to come out of. So if you think about it, you essentially have two walls that the groove is forming that patella is sitting in. And so if it's deeper, then that wall is taller, it's harder for that kneecap to come out. Other things we'll do is soft tissue type procedures. So we'll break down some of the scar tissue, tighten up some of the areas that need to be tightened up to prevent this luxation from happening again. Sometimes we'll put little sutures in to hold the patella as well. All of this is done intraoperatively, making clinical decisions based on how that patella specifically lines up. Very rarely, but occasionally, we have to do major limb alignment procedures where we correct the direction of the thigh bone so that we can realign it that way. That's most commonly seen in the larger breed dogs, the medium-sized dogs, and even more commonly a problem when we have lateral patella luxations. At-home recovery for patella realignment surgery is probably the hardest part on most clients. We break up the at-home recovery into essentially 2 periods of time. So the first 8 weeks, we're going through our healing phase. So this is where our bones are healing back together. We're developing our scar tissue so that we have long-term stabilization of the kneecap. The second period of time is usually a 4 to 6 week period where we're rehabilitating all the other muscles, ligaments, and tendons that have atrophied during our healing process. So let's talk about the first 8 weeks. So the first 2 weeks of that 8 weeks, we're really on bed rest. We have an open incision that needs to be healing, and we're wearing the terrible cone of shame. During that time period, we need to be confined into a single room in the house with no running, jumping, or playing, and limited stair use. When we go outside, we're always going to be on leash, and really it's just going to be potty breaks and back in. So 5 minutes or so before we come back in and rest. At the 2-week mark, we'll have you come back in and we'll assess the incision. Assuming the incision is healed appropriately, the cone of shame will go away and we can resume normal bathing. We will still be confined into a single room in the house for the next 6 weeks, so 8 weeks total, but now we're going to go on prescribed on-leash activity. So from weeks 2 to 4, we'll recommend 5 to 10 minute leash walks 2 to 3 times a day, nice and controlled, nice and slow. Weeks 4 to 6, we'll recommend 10 to 15 minute leash walks. In weeks 6 to 8, we'll recommend 15 to 20 minute leash walks. We will still be confined to a single room in the house for that full 8 weeks with no running, jumping, or playing, and limited use of stairs. When I say limited use of stairs, what I mean is if your dog is small enough to carry, then carry them up and down the stairs as needed. If your dog isn't small enough to carry, then we want to have them on leash as they're going up and down stairs so that we have control of them and they're not flying up and down the stairs like they traditionally would do. At the 8-week mark, we have you come back in. Typically, we'll be taking x-rays at that point to ensure the bones have healed back together, make sure that patella is appropriately aligned, and we'll be doing some assessments to feel how everything feels. At that point, assuming everything is healed appropriately, then we'll enter into our rehabilitation phase. The rehabilitation phase means that we can move freely about the house again now. There's no limitations as far as our activity inside. But we've taken a professional athlete, which every dog is, and we've made them essentially a couch potato for 8 weeks. So we've atrophied all of our muscles, our ligaments, our tendons. So if we were just to turn them loose at the 8-week mark, they're going to pull something else. They probably won't damage or injure the surgical site anymore, but they'll pull a muscle, strain a ligament, something like that. So what we're going to do is we're going to do 2 to 4 weeks of unlimited leash walks. So as long as they want to go on, as long as they can go on, that makes them still be comfortable. After 2 to 4 weeks of that, we're going to do another 2 to 4 weeks of controlled off-leash activity. So this means in the yard, somewhere where they're not running, not able to bolt, not at the dog park or at the beach, but somewhere where we can watch them and make sure that they're continuing to progress in a positive way. Assuming they are doing great at the end of that 6 to 8 week period, now they're able to go back to normal activity. Now we don't typically see you back at this point, though we may ask to see you back one more time depending on how our progression is going. But we're going to trial them off and going back to normal activity at that point. That's the basics on the recovery period. If you have any additional questions or concerns, feel free to contact your primary care veterinarian or schedule a telecommunication consult with me through my website. Thank you so much for your time.